So hello guys out there. I'm here together with Garry Coles from the UK, and Garry is somebody I met a few years ago for the very first time. I think it was in Las Vegas at the swimming pool, and there we start talking. And the last years I saw Garry quite a lot at different conventions all around the world. Because Garry is the guy that is invited to speak about hypno-oncology, about how you can help people getting through the cancer journey. So, and that's why I asked him to come over here to Belgium to do a one-day training about that topic, because he's the specialist. And as you know, I always want to have the specialists here so that they can give the training with something that they are used to work with something that they have a lot experience in. So, Garry, welcome to this interview. Maybe first tell something about yourself. Who's Garry Coles? What are you doing on a daily basis? And
Okay, well, hello, nice to see you again, Rob. Right, yeah, I'll tell you a little bit about myself. My name's Garry Coles, and as you said, I'm based in the UK. I'm a full-time hypnotherapist, have been for over 15 years now. But my specialism, where I'm coming over to see you in Belgium, is hypno-oncology, using hypnosis to work with cancer patients. Now, my background in that is that, as in quite a lot of parts of the world, hypnosis in the UK is not regulated, but it is possible to actually study it at university over here. And I think there's only a handful of us, there's not many, but I was in the first cohort in the UK to actually obtain a master's degree, Master of Science degree in clinical hypnotherapy. And to do that, part of it, we had to write a thesis and do a research project. And because of my background, going back, my specialism in hypno-oncology, I've actually worked for 14 years, 1 day a week in an oncology unit at a cancer hospital here in the UK, under the auspices of the National Health Service. So it's a government regulated one. And we offer complementary therapies there. And I've probably worked with about 2,000 cancer patients over the years. And have developed a lot of specific techniques and approaches through my experience there. But when I did my master's degree, I decided I wanted to do some medical research. And I actually did research into looking at pre-surgical hypnosis and the effects that had on the recovery quality in breast cancer operations. And it was done scientifically through the university, and I was able to demonstrate that hypnosis did indeed have quite a positive effect in the recovery quality in the operations, both psychologically and physically. We found it had an impact on pain perception positively, but it had a great impact on the psychological well-being and the recovery rate. So that sort of really started to get me known, having done that research. And again, I just carried on as I do in the hospital, working with people. And I ended up doing a couple of things like this, got a couple of podcasts to people because people were interested in the work that I do, being a very specialist area. And obviously, because I've got so much experience, it suddenly dawned on me that I seem to be one of the world experts in that area. And things sort of took off from there. I was asked to go and talk at a UK conference, and it escalated from there. But as you know, I go all around the world talking at various conferences. I think I've got about 7 or 8 in the UK. Sorry, this year I think I'm in the UK. I'm in Europe. I've got a few in the USA, one in Canada. Just come back from doing some training in Bahrain. So again, it seems to have gone a bit crazy, and I now wanted everywhere to talk about it and teach.
the moment they know you, they want you everywhere in the world to speak about the topic, especially because it's a really specific topic, of course. I can imagine there are not many hypnotists around the world, apart from the guys that you already trained, that are specialized in this topic. So yeah, it's the very first time that you come to Belgium. So what will the students learn during this one-day workshop?
They will learn an awful lot of things. It's a very highly packed one-day workshop, but in fact, in some cases now I've been asked to make it a 2-day workshop because there's so much in it. And they will get a lot of backup as well. The things that we don't cover on the day, there's a Facebook group that they'll be able to look at extra audio, extra video. There's also extra sort of backup sort of sessions on there, so that there'll be a lot more than just the day. But what they will learn on the day is that we will learn all about cancer itself, which is very important, because if you're in a hospital environment and you're dealing with surgeons and doctors, you're another cog in the wheel of people on their cancer journey. And people will come into you, they'll give you their intake sheets, and they'll say, well, I've got stage 2, grade 3, such and such cancer, and this is my treatment regime. And of course, one of the big things we have in hypnotherapy is rapport. So you'll lose rapport if you don't understand what they're talking about. And being in a hospital environment, you'll need to gain credibility. You'll need to be able to talk to the doctors, the surgeons, and everyone else. So we will have a very intense part of the course. You'll learn all about cancer, about its formation, its staging, its grading, the treatments involved, and particularly the side effects of the treatments involved, because that's a very big area where we can work with hypnotherapy. We will look at a lot of ways of communication, which is quite important. And then we will look at a lot of techniques. There's about 7 or 8 specific techniques that I'm going to teach on the day. We include some very fast sort of techniques that are required, because sometimes if somebody's just been diagnosed, they might be having panic attacks and things like that. So in certain cases, you'll be faced with somebody that's having a panic attack or anxiety attack due to fears or phobias or diagnosis. So you need to have an armory of very fast interventions. So we will teach some of those. We have a particularly good technique that I have, which is a combination really of ego state therapy and very authoritarian parts therapy, which I find is very, very powerful and works for a lot of things. I'm going to teach that on the day. We're going to do a lot of pain control work, probably stuff that people have not come across before. We're going to do a lot of work on side effects of treatment side effects. So we will talk about those. We will teach all these techniques. There will be some PDF documentation. I think there's about 250 pages of documentation. They will go to a couple of dozen scripts, about 25 scripts to take away, transcriptions of all the techniques we work with. And we'll also look into areas such as ethics. We will also look into areas such as psychoneuroimmunology, PNI. That also has a big impact in working with cancer patients, and I think will have a very big impact going forward. The day will be very empirically evidence-based, because obviously from the master's degree background, I come from a very scientific point. So it will be from that particular background. And what I've actually done now is there will be an optional exam that people can take online at no extra cost, because we now have the Association of Hypno-Oncology Practitioners. And what I want to do with that, and we now have them all around the world, in America and the Middle East and so on. Because what I want to ensure are that it's all very well people coming on the 1-day course or a 2-day course, but I want to ensure that they are competent enough in other areas of hypnotherapy and very ethically sound and so on. So there will be an optional exam for people to be able to join the association. So that's something that I'm looking forward to as well. So that's in a very quick nutshell what they look for. So we will look to work with patients on the whole cancer journey. So it will be from first diagnosis through the initial treatments, through the fears and phobias, pre and post surgery work, which can be very powerful, working with side effects and even beyond, and even palliative care, which unfortunately some ways that's where it goes.
Okay, so this course is open for everybody who has a background in hypnotherapy. They don't have to be medically schooled. They don't have to
Not at all.
know a lot about all the medical terms, because you will introduce them to them. So, because I had a question this weekend, somebody who already signed up, and then she was wondering that the training was good for her because she doesn't have that medical knowledge, of course. But that's something that is included in the training as well.
It is, yeah. We have all sorts of people. In fact, obviously, to be part of the association, people have to be very competent hypnotherapists. But I have had people on the course that have really enjoyed it, that are just newly training in hypnosis. You know, they might have only had 1 or 2 weekends of training. I've had a couple of people that have had no training. And I've even had nurses and psychologists and psychotherapists actually coming to the course and finding that it's been very, very useful for them. So yeah, it's for anybody. All the medical terminology and explanations will be given as part of the course.
Yeah,
everything you need to know will be there.
Yeah. So yeah, it sounds like a full day with all different techniques and a lot of information. Of course, I already saw that you're giving a lot of extras and a like a library where they can go back and see some videos and
Yeah,
PDF files and things like that?
that's the other thing, and I will plan. Hopefully, on the day we will record the demonstrations, because hopefully we'll do 6 or 7 demonstrations of the techniques, because I like people to be able to see them. And generally, what I try and do is to video all the demonstrations that I do, because all demonstrations will be slightly different, because you know, the
Yep.
way we deal with hypnosis, and it's nice for people to have a record of the demonstrations that they experienced on the day.
Yep.
So that will be put up onto the Facebook group. But I have the demonstrations of all the different techniques that I've done at all the different courses, so they can see the variations on the techniques with different people and different issues that we work with.
Yeah, yeah. Especially for our students here, it's very good that they can watch back the training or the demonstrations because of the language, of course.
Yeah.
They are not native English speakers, and sometimes, yeah, there are some words that they don't understand. But then it's easy that they can rewatch the training and then the demonstration. So that's really good. So yeah, we will do the full recording of the training, and they can watch the demonstrations. And of course, a Facebook group is also an advantage, because whenever they have something that was not clear, maybe due to the language, they can ask a question in the Facebook group, and there will be support after the training as well. That's something
Absolutely, yeah.
I really
Yeah,
like.
we
We
can
do the
even
same
put,
here, and that's very good that trainers
yeah,
visiting
yeah.
here are doing the same.
Yeah, we can you know, we can put a Facebook Live thing together for them if they want some further follow up. That
Yeah.
wouldn't be a problem at all.
Uh-huh.
That's what we tend to do.
Yeah. So, and in general, when you're working with those type of patients or clients, how many times do you see them during that the journey? How many sessions do you have
Uh,
in a regular case?
Again, it can vary greatly depending on what you're dealing with. Some people I might see many times because we're going through the entire journey,
Mm.
whereas some people you just see once. You might have to do an emergency intervention for a particular reason. So it can be anything from 1 up to sort of, you know, 10 or 12 times.
No.
Again, depending on the issues that you're working with and so on.
Yeah. So one of the questions that that I have in my mind, and probably my students as well, how do you promote this? How do you tell the world, or how do you market this? Because of course you can do this training, but you need clients, so you need to come out with this news that you are not treating cancer. Of course, that's really
Yeah.
important. That's not about, the training is not about treating cancer. It's about getting people through that journey. Will you give some advices or examples, or maybe of your approach? How
Yeah.
do you get the news out that there is a new practitioner in town?
Yeah. Well, again, for people that actually go on to take the exam, there are logos and badges that they can put on their website. We do now have a Hypno-Oncology website, so we're going to start promoting that around the world. There is also a Hypno-Oncology Facebook page, so we're starting to promote that. From my own point of view, I find that in the UK particularly, hospitals are a good place to go, hospitals and clinics and so on. I'm based in a hospital, so I get clients both in the hospital and private clients from the hospital. Again, because I mention it on my website, and I'm known for it, I actually get clients from all over the country. They will sort of have, we can do Skype sessions as well. And I've worked with Skype sessions from people all over the world. You can't use all the techniques, but quite a lot of them are adaptable for Skype sessions. And again, we will cover that to an extent on the day. Not so much on the one-day course, but again, there will be videos for a video lecture on that they will have access to on the Facebook page anyway.
Okay, great. So yeah, is there some story that you can tell about the results that you had, or a specific case that jumps in your mind now?
What I intend to do on the day is actually give a lot of case studies, a lot of case histories, because and a lot of people have said in feedback from all the previous courses, that's one of the things they've enjoyed most. Generally, the things they enjoy most is the demonstrations, but also all the talks of the real life case histories of how I've used the techniques and the advantages they've had and what's happened through them, because a lot of them I bring up a lot of interesting case histories where it does involve thinking outside the box and probably not going down the routes that you might necessarily have thought that you would go down. So I'm going to save those to the day.
Yeah, of
um,
course, I can imagine. No, I can imagine that every client or every patient is different. Every story is different. Every journey that they are going through is different. So of course, yeah, the case studies will be a really important part of your training, I can imagine.
yeah, very much so. One of the things as well, I mean, ethics we look at as well, and so on, communications and PNI. There's a lot of advantages for hypnosis, which is why it can be useful for getting in with hospitals and things now, because for example, there's reduced costs. And less stress for frontline staff, because if we're dealing with the fears and the phobias and the anxieties, then the frontline staff, the nurses and the doctors aren't doing it. My own research has seemed to indicate that pain control medication became more effective with hypnosis involved. So therefore, there's better pain control. There's less costs on medication. It's freeing up bed space. It's giving patients coping mechanisms. So there's a lot there. And we also give a lot of there's a lot of research that's been done. And again, we'll bring up the research on the day to show the evidence of where this is coming from.
Yeah.
But the other thing of why I started doing this course, and the ethics side as well, is the statistics are quite frightening nowadays. I mean, people, and that's why I think people should be involved in this area, because in the Western world, they're saying that 1 in 2 people born since 1960 will actually be affected by cancer in their lives. So it's 50%. And it's things like 1 in 7 women will get breast cancer, 1 in 8 men will get prostate cancer. So it's quite big. And interestingly, it's SAGE research actually did some research and showed that 40% of people undergoing the cancer journey will seek complementary therapy. So that means that theoretically 20% of the population could be coming to you for assistance. So that's a very big market.
Yeah, I can imagine it's and not only I heard you speaking, and it's on the website also that you will teach some pain control techniques, also some pre-surgical hypnosis. But of course, I can imagine even when you have clients, they don't suffer with cancer, but they have to go for an operation. People can be afraid of the operation. You can use those techniques also outside of this topic, I can imagine.
Oh yeah, all the techniques that I teach you can use for a multitude of things. In fact, it made me laugh. The very first course that I did in this, and every course I've had has had absolutely rave reviews and testimonials, but I only ever had one complaint, and that was at the very first course that I taught. And the complaint was from well, the gentleman had made 2 complaints. Number one was I talked too much about cancer, which I thought was rather strange as it was a cancer course.
Yeah.
And the second one, he complained that most of the techniques that I taught, he could use with patients without cancer. So, I'm not quite sure why those were complaints.
No, I don't see the. I think that's a benefit because, of course, you can use these techniques with all different kinds of issues and clients. So that's a very good thing, of course.
Yeah. And the other thing of why I sort of do it in a course, it's interesting to note that I found that from my experience with hypnotherapists that contact me, there is an awful lot of very competent hypnotherapists out there, highly trained, competent and ethical hypnotherapists. But as soon as they're faced with somebody that they know, particularly it's a family member going through the cancer journey, they just tend to panic. It doesn't matter how qualified and experienced they are, they just tend to panic of, well, what can I do? So this is going to give you the tools to do that, to assist in that. And also from an ethical point of view, because the other worrying statistics that I've seen, I'm very worried that people tend to try and take advantage of desperate people like those going through the cancer journey. And some of the statistics I've seen, there was some stuff done in America by the American Society of Clinical Oncology, and they recently done research with 4,000 adults. 25% of them of those had or did have cancer. And it was really worrying, the statistics. 40% of them believed that cancer could be cured by oxygen, diet and herbs. And nothing else. And half of those thought that cancer could be cured by complementary therapy and nothing else. So again, we need to educate the public and the practitioners, because the sad fact is alternative therapies alone actually doubles the mortality rate, and on early stage cancers it actually increases the death rate by 6 times.
One of the things that I always mention in my trainings is don't don't say that you can cure cancer. The only thing that we can do is help people to get with the side effects and things like that, and then maybe we can also help them to get better. But we're never gonna say stop with your medical
No,
treatment because
absolutely.
I'm gonna cure you. So no,
Yeah,
that's something really important, really important.
absolutely.
Yeah, of course, of course. So one of the things that you mentioned,
Hmm.
and that's maybe you can give some just an explanation about what it is. PNI. What's
Yeah.
something that you're going to talk about? So
It is, yeah, and there's actually a full lecture on a video lecture actually online of it that they'll have access to. Yeah, psychoneuroimmunology. It was really, the phrase was coined in 1975 by somebody called Dr. Robert Ada, and it basically it's looking at the connection between the immune system and emotions, and it's now found that the immune system can be influenced by emotions. And as we know, emotions can be influenced by things like hypnotherapy. So there is actually evidence now and research being done that by using hypnotherapy, we potentially can change the makeup of the immune system. And therefore that has a great impact on the cancer journey and the treatment going through. And research has actually shown now that there's evidence that we should be looking at a more holistic approach with cancer patients, particularly in the areas of psychological and social care. That is where PNI and hypnotherapy actually comes into it.
okay, sounds really interesting. I don't see how you're gonna fit that all in one day, but yeah, that's your job, of
Yeah,
course.
yeah.
No, I'm really looking forward to see you here in Belgium. So yeah, watchers from all around the world, you're invited to come over to Belgium to do the training here live. But you can also, if you're not able to travel to Belgium, you can follow this training also on live stream. So you're able to do this training on live stream, or if the time zone is really difficult, you can watch the replay later. There will, even if you're on live stream, there is the possibility to ask questions, and so then you will also get access to the Facebook group and the replay and all those things. So there is no reason to not do this training the 1st of March. You will find all the details and the links on the post of this interview, so you can click on it. And if there are any questions, Garry, I think they can find you on your website, or they can send you an email if they have
Absolutely,
any
yeah.
questions about the
Mm.
training. Especially when the questions are about the details, especially for people who want to travel to Belgium, we can help you with hotel rooms, even with the discount when you sign up for this training. So then you can contact me, of course. But when you have questions about the training, about the topics of the training, then it's better to contact Garry. Yeah, directly, of course. And he, as you heard in the introduction, he's also traveling the world. So maybe he's having a training in your neighborhood, and then you have the chance to do the training live, or you can do it on the live stream. So Garry, thank you very much. I'm
Thank you.
really looking
If they
forward to
want to
see you.
contact me, the best place for them to look for where else I am and to contact me is we have a website which is www.hypno-oncology.com.
Okay, I will put it in the show notes as well, so that they can click on that
Yeah,
URL.
yeah, and there's a form there, contact form, if they want to ask any questions
Okay.
or email, and also says where else I am apart from Belgium.
Yeah.
For
Okay.
those that are in the States, there are going to be some courses in the States and Canada and so
Yeah.
on as
That's
well.
great.
Yeah.
Okay, so really looking forward to hosting you here in Belgium,
Yeah, I'm
and
looking forward to being there.
yeah, I see you in a few weeks.
Yeah.
Okay, thank you
All
very
right.
much.
Thank you very
Bye.
much.